Well, and good morning, good morning, good morning. I don't seem to have any video. Hmm. Here we are. Well, so nice. We had to do it twice. Welcome to SOS Soul Filling Our Sisters. I'm your girl. I'm your host, breast surgical oncologist, Dr. Monique Gary, aka Dr. Mo. I am one of the medical advisors for Touch for Life, who brings this programming to you every fourth Saturday here on blackdoctor.org. Our goal is to fill your cups, to bring you with the relevant information that you need for health, for wellness, everything as it relates particularly to cancer risk reduction in the Black community. And we're also bringing you tips on movement, meals, mindfulness, clinical trials, and research. And today we got a great one for you, because here we are on the heels of and the aftermath of Juneteenth, and we are our ancestors' wildest dreams. We know that there is earned medical mistrust in our communities, and we want to bridge the gap. I personally, as a physician, as a surgeon, want to bridge the gap with our communities in order to make sure that we are living a healthier life than our ancestors, and that we have more opportunities in cancer research and to improve the outcomes that we're seeing in our community. So that's what we're talking about today. This is a serious topic for your cup. I hope it's deep today. We want your questions. We want to know where you're from. Put it in the chat. But today, this is SOS Soul Filling Our Sisters. We're here every fourth Saturday on blackdoctor.org, and we are so grateful to our sponsors, Hologic, High Impact Partners, and we're talking today about the trials that you want. So stay with us, grab a friend, bring your cup, and get ready. It's SOS. We're jumping right in with our first guest. I'm so thrilled. I'm fangirling out today. Thrilled to be joined by Dr. Camille Brock. She is a farm PhD. She's the chief medical lead at Acclimate, and she's going to tell us what that means and what she's doing there. But she has, get this, when you look at her CV and her resume, 16 years in pharmaceuticals. She held roles at AstraZeneca, at AbbVie. She's been part of strategy for DEI, strategy for healthcare communications. She's a leader in health equity a top 40 under 40 leader in minority health at the National Minority Quality Forum, our dear friends in 2023, where she was highlighted and honored for that. And she's a research maven and research champion. She earned her PharmD from my alma mater, Florida A&M University, and a Health Disparities Research Certificate. Yes, Rattler, from the University of Illinois, Chicago. Welcome, Dr. Camille.
Hi, how are you? Thanks for having me. It's nice to meet you, Dr. Mo.
It's so wonderful to meet you and see you, and it's so great to see what we all end up doing after we leave the hill, right? Highest the seven hills. And who knew all that we would do and all that we would be because of the education we received at our beloved HBCU alma mater. So we're going to talk about it. But before we do, I want you to give us a little bit more of your background. And in particular, I always ask this question. Tell me your why. Why do you do what you do?
Mm-hmm. Well, as you mentioned, my name is Dr. Camille Pope, and I'm the chief medical lead at a company called Acclinate. And we have a community engagement platform where we encourage clinical trial participation and bring a lot of education and engagement to communities of color, because we've been historically underrepresented when it comes to clinical trials. How did I get to that point? So as you noted before, I graduated from FAMU with my PharmD, and I worked in pharmaceutical industry for several years in the area of medical affairs. And so I was responsible for communicating data to physicians and pharmacists and researchers for new drugs that the companies that I was working for had brought to market. And I worked in many therapeutic areas, HIV, hepatitis C, and most recently, before coming to Acclinate, I worked in oncology. And so I was like the medical director for prostate cancer, breast cancer, and pancreatic cancer at a major pharmaceutical company. And I got a bit frustrated because I was seeing how we had this amazing data that we were presenting, at these meetings, and we were bringing these drugs to market. But when I was asked to communicate it, and I would look at the demographics of the people who were in the clinical trials, especially for prostate cancer, I was like, but there's nobody included here that looks like my dad or my brother. And the people who I know in the real world will get these drugs are most likely to, be diagnosed with prostate cancer, like Black men. Same thing with breast cancer and pancreatic cancer. And the other drive behind my why is that I have a situation with a family member, a close cousin of mine, who was diagnosed with breast cancer at the age of 47. And, I saw how clinical research could have been an option for her, but it wasn't necessarily offered as early as it could have been. And so towards the end of her life, I tried to play an integral role in identifying clinical trial opportunities. And she was open to it, but it was like, dang, what if it had been offered to her sooner? Like, would that have made a difference in the trajectory of her cancer journey? And so it was through all of that, I was like, okay, I need to do something different and take all of this experience I have in pharma and medical affairs and educate the community about the importance of being involved in clinical research, specifically our Black community. Because if we're not involved, how do we know if the drugs are going to work just as well in us? I say all the time that as a human race, we are more alike than we are different. But there are certain biological differences, based on our ancestry. There might be metabolic differences that do impact the way a drug works in one person versus the next. And we don't know that unless we are all involved in the research and the evaluation of the drugs when they are being studied. And what we don't want is for drugs to come to market and, you find out after the drug has been used and prescribed in millions of people that, there's a certain segment of the population where the drugs aren't working as well. Mm-hmm. So I've made it my personal mission to, I like to say, educate around the process of clinical research to our communities of color, particularly Black folks, but really all underrepresented populations, to educate about the process, educate why it's important for us to be included, to empower us to ask about clinical trials when we are in the physician's office, and know that clinical trials they should be a care option just like any other care option, like a drug being prescribed or a lifestyle modification, and to also encourage people to make a decision on whether or not they want to participate based on facts and not fiction. I'm all about people
Mm,
being informed. Like, we understand
okay.
historical atrocities and why you might not want to do it, but base your decision based on the facts of what the research process is like now, versus, something that you might see on the internet that is not true. So
Mm.
that's my why.
I love that. And you're right, the facts versus the fiction. I wonder if we should talk about some of these myths and things that people are told and misled about. And I'll start off. We can round robin this thing, but the first one that I hear all the time is that, as a surgeon, as a physician, we have the cure. Y'all have it. You just don't want us. You just don't want us to have it. But talk about some of the other myths that you might have heard that influence people's decisions to participate in clinical trials.
Sure. I think one of the biggest myths that I hear is that, everybody is going to get a placebo. And people don't necessarily understand like what a placebo means. It's unethical for, if there's a drug approved on the market for your particular illness or disease, it's unethical for you to get just like nothing if you're in a clinical trial versus whatever the active drug is. So
Mhm.
you'll, you know, 99.9% of the time, at least get the standard of care, like what you would have gotten if you weren't in the clinical trial, or you'll get the alternative, which is, the drug that is being studied or evaluated as a new treatment. So I hear a lot of fear about, well, what if I don't get anything? What if I just get a sugar pill or a water pill? And that's a common myth. And I like to tell people, like, no, you'll at least get what's considered the current standard of care, unless there's nothing available. Like, there's nothing available. Like, if you think about COVID, where there like literally was nothing until the vaccines that did become approved became approved. Well, then that was a little bit different because there wasn't a standard of care. There wasn't some drug that could be used to test the activity of the study against. But in the majority of cases, like, you're going to get a standard of care. So it's not like you're just going to get a sugar pill or a water pill. And I think sharing that with people, they're like, oh, they don't necessarily realize that. They think that there's a chance that they just might not get anything for whatever illness they are suffering from. And that's unethical. So.
Mhm. No, I agree with you. And we're going to put some of those in the banner. And while you're with us here every fourth Saturday, SOS Soul Filling Our Sisters on blackdoctor.org, we want you to tell us in the chat where you're from. Tell us any myths you might have heard about cancer clinical research. Put your questions in the chat. We're chatting all morning with some experts. These are the best and the brightest of the field, folks who are leading the charge, walking the walk and talking the talk. And so let's talk about it a little bit more, Dr. Camille. With your extensive background in medical affairs, and now you're at Acclinate, how do you approach the challenge of increasing diversity in clinical trials?
Sure. So at Acclinate, we have a community engagement platform called Now Included. And it's called that because it's like, now is the time for us to be included in the discussion about clinical research and within the healthcare conversation in general, because oftentimes as a Black community, we aren't included and we aren't represented. And so Now Included, really, we use a combination of what I like to say, touch plus tech, to meet people where they are and to share resources around disease topics that they care about, around clinical research, and then also offer clinical research opportunities when there are ones available and help them get connected to clinical studies. So we have our community engagement platform. Y'all can go join www.nowincluded.com. We love to have you. And so it exists digitally, yes, but then I also like to say we're in the streets. It's like, so we are literally, in different cities, bringing the same information to where people are. And it doesn't necessarily have to be like a health fair, although we do go to health fairs often. It might be at a back to school event. It might be, at your church. It might be at a little league baseball game where we know families are going to be there. And we start just engaging and having these discussions to help build trust. And the discussions don't necessarily have to start with clinical research. It's just for people to know that we're here and available to share resources again around health topics of interest that they care about the most. And as we start to build relationship and build trust, folks become more open to hearing the education that we're sharing around clinical research as well. The other thing that we do with Now Included is we provide a platform for people to share their stories, because we understand connection and hearing from people who look like you, who may have been through similar experiences, who have a similar culture, who may have had the same illness that you had or been involved in clinical research. By hearing from folks who you can easily connect with, it might make you more open to wanting to participate in research as well. So on our platform, whether it's, again, the Now Included website, or whether you can find us on Instagram, you can find us on Facebook, we're everywhere. We'll sometimes have our Now Included community members, like you're going to hear from Ms. Lucretia later on, share their stories. We have other ambassadors and experts who come in who might talk about, owning a black owned clinical research site and what that's like, so that our community members know that, like, yes, there are Black researchers out there that own sites that you can go to and be involved in a clinical study if you want to. We're sharing all of that on our platform as a means of community engagement and building trust, and bringing people into the conversation around healthcare and research.
This is incredible, because I think you're filling a huge gap in that. Many times trials are developed in a vacuum, right? They're developed in these clinical silos or in these academic institutions, and they don't always include, one, the physicians, but two, the advocates, and three, the community, right? There has to be this neural network of all the stakeholders at the table. And when I say stakeholders, I mean everybody who's involved in this. And, nothing about us without us, right? And so here you are making sure, I love this, that you all are connecting with the community. But let's talk about that, because you mentioned some of the strategies, like reaching out to churches and engaging the Black community. How does that then translate into enrollment into trials? Tell us a little bit further about, what you're learning from that community engagement.
Yeah. So what we're learning is, as we said earlier, there are a lot of myths that we end up needing to dispel, which is fine. We also hear from people, why they distrust. And so I think one of the most important things we do is not make people feel like you're forced to participate in clinical research. We want it to be your own decision. But we want it to be an informed decision. So we're literally sharing information. But we find that people are eager, number one, to tell their healthcare stories because they feel like they haven't been heard before. So that's when we're like, well, come on, share it on Now Included, share it on our platform, because other people want to hear from you. But we also hear, that people are actually interested in participating in clinical trials, but they are not asked. And so we know that there's, bias that exists in the healthcare system. We also know that a lot of our community members aren't necessarily being treated or seen at these big academic medical centers where clinical trials are typically run. They're maybe going to their community physicians, and that's okay. But that's one of the reasons why trials aren't reaching them, or why they're being offered trials, because maybe their physicians aren't running them or don't know about them. So we identify these gaps. And one of the cool things we're able to do is work with research sponsors, pharmaceutical companies, whatever entities are running studies, and take these insights back to them so that they can revise their strategies and do better with reaching the community. So we're serving as a bridge builder because a lot of times the research sponsors are working with their own assumptions, and so they're not necessarily engaging the community in the way that the community wants to be engaged. And so we're able to say, well, we're doing that. So here's what we're hearing, and here's what we're learning. If our Now Included community members are telling us, they're not really into traveling, let's say, more than 25 to 50 miles for their healthcare, you placing a clinical trial site as a research sponsor 55 miles away and then requiring 15 follow-up visits over the course of a year for the study is not going to make the diverse community that you're trying to reach want to participate.
Come
So
on.
we gather those insights through the trust and relationships that we're building with our communities. And we let them know, like, we are working on your behalf to go back to these sponsors and help them think differently about how they approach you and their care and their diversity planning for clinical trials, so that you can get the opportunity to participate if you really want to.
I love it. Dr. Camille, I want you to stay with us because we have more questions
Sure.
for you and more opportunities for you to share the mission and the work that you're doing. But, everybody likes a giveaway. And so we got to pause for the cause real quick, because one of the great things we do on this show is that we give away goodies. So it's time for our giveaway moment. We're going to put up our QR code. There it is. Touch for Life, the organization that brings you this programming every fourth Saturday, is having a giveaway. What is it? It could be a mug, could be a t-shirt, it could be information, could be an opportunity for you to attend one of the Black Jeans Matters parties. But you got to click the QR code and join our community in order to find out. So please click the QR code. Take a picture of it, send it to your family, to your friends. They can be in the giveaway as well, because we want everybody engaged in this information, joining the Touch for Life community. So we want to make sure that you are on our list to receive information about not only the programming that we offer, but about the events that we do. There it is. Join the Touch for Life Soul Filling Our Sisters community today. Now, let's continue this conversation, because it's one thing to hear from scientists and PhDs and PharmDs and MDs and DOs and doctors about research and clinical trials, but it's another thing to talk to somebody who's been in a trial before. And so I have the joy, the privilege, the honor, and the opportunity to introduce somebody who's going to share her experience with you. I want to introduce Lucretia Day. She's a triple negative breast cancer thriver from Birmingham, Alabama. And I'm going to let you tell your story. Okay, Lucretia, how you doing today?
Hi, Dr. Mo. I'm so excited to be on here with you today.
It's great to join you. It's great to have you with us here. We're talking about filling up our sisters, and I want you to share your story, because, there's power in our narratives and in our stories, and people sometimes feel afraid to talk about what happened in their health, and we're debunking that myth today too, that it's your business and it isn't anybody else's business. So tell us a little bit of your business and why you're doing the business that you're doing today.
All right. Well, a little bit of my business is in 2021, I was diagnosed with triple negative breast cancer. And of course, it was one of those things where it was a shock because I mean, when I went, I'm like, okay, yeah, I feel something, but I'm not sure what it's supposed to feel like. So we'll see. But then to actually hear that it is cancerous, that's another story. Well, thankfully, I had a very, very, very amazing radiologist that was the one that diagnosed me. And everything from her FaceTiming me to giving me the final diagnosis, letting me know that it was triple negative, to her sending me to a personal friend of hers that was a breast cancer surgeon, and then them connecting me with my oncologist and radiologist. And when I tell you, they were all participating with each other via text message and everything, it was an amazing experience. But I also realized that experience, that most people don't have it that easy, I guess you can call it, because, a lot of times people are left to find the next doctor, to go from being placed with an oncologist to finding a surgeon to finding someone that's going to do their radiation and things like that. Another thing that I also experience, if you really want to get into my business, is just having to maneuver through the whole resource thing. Um, I have worked in nonprofit for the past 20 years. And I am used to being that person that kind of finds resources for other people. So when it came time for me, I'm like, oh, okay, well, this is going to be easy. I know places, I know people, but I did not know the red tape and how much information is kind of kept close.
Mm,
You hear about these organizations, but you don't know that, oh, well, you got to show basically your past 30 years in your income tax and give them the left arm of your first child and the right foot of your last, you know?
Wow.
So it becomes very difficult to maneuver through the process. And I know it sounds weird, but I thank God for my journey because it allowed me the opportunity to see what my future clients may have to experience, so that I can help them through their journey as well. So
Hmm.
it's definitely been something that was life changing, but also eye opening, just to see how we don't really have the resources or the knowledge of the resources that we think we do.
Wow. And it's saying something when you who work in advocacy spaces, and you're an informed person, but when you get a diagnosis of cancer, you don't know what you don't know.
You
And I
don't.
hear you saying, right, that you even had somebody who handheld and walked you through and FaceTime with you and connected you to people, and you still felt out of the loop. Like how difficult must it be for a person who doesn't have that type of support to really navigate their way? And then you throw in something like a clinical trial. How did you connect about a clinical trial, and how did you do making that decision? Like, walk us through that thought process of, am I going to be part of a trial or not?
Okay, well, one of the things that I had to get through, first of all, I had to accept my diagnosis and then decide, okay, even though triple negative breast cancer, I never heard of that. I had to figure out what that was. So that involved me asking questions, asking lots of questions to my doctors, and also doing a lot of research on my own. So, one of the things people will tell you quickly is do not Google, because when you Google, oh boy, that takes you down a road. It takes you down a long road, and it could be a tough road if you allow it to be. But I tried to go on websites that I trusted. BlackDoctor.org actually was one of them. Um, and several others that my oncologist had referred me to, but just trying to find out exactly what that meant, what that the different percentages were of people that survived that type of cancer, because I had a family member that passed away from breast cancer, and that was scary to me. So um, I had to educate myself and get that knowledge and figure out, okay, so if this is what they're saying, then what can I figure out as ways to do? So you have to understand that I'm that person that I don't take medicine. I don't like to even take anything for pain. And going through chemo and all that stuff, oh, that's a whole nother different world. So, as I'm searching online for different remedies for nausea, I mean, because I had like 4 prescriptions, but I didn't want to take them. So I was looking for different things that could help with this. I stumbled across Now Included. And I was like, oh, okay, let's see what this is. As I look, I'm like, oh, this is for us, like people like me, you know? So people of my color, people that experience the things that I experience, people that may have to go through some of these same hardships that I'm having to go through. So as I just went through the website and saw some of the things they did, I started signing up for some of the surveys. And I'll be honest with you, initially it was because a few of them offered money to sign up for them. And at the time, having to pay the copays for treatment, going into the 401k to do the deductibles and all that kind of stuff, it was like, all right, girl, whatever you can do to get some more cash coming in, let's do that. So that's how it just became a huge resource for me, again, stumbling across it. Not that anyone showed it to me, I just kind of stumbled across it. But I guarantee you that now that I know about it, I have definitely shared with many, many people that I have come into contact with.
That's incredible. And I think, you doing that research is going to help to save some lives and free some people, as they're going through their journey. So what advice would you give to others in the community about advocating for themselves when it comes to clinical trials and cancer treatment?
Actually, that's you said a part of it already. Um, you have to be your own advocate. You can't depend on anyone else to do that for you. I mean, even though we have people that are out there like Dr. Pope and you, of course, but you still have to be an active part of your journey. So, I mean, that means just going out there and gathering more information, just finding whatever you can, and Then the other thing that I'm going to suggest, and something that a lot of us do not do, but we should do more often, ask questions. When you're with your doctors, they are there for you. Ask questions and don't be afraid to say, well, I'm not so sure about that one. Can you give me some time to think about it? Or can you give me some more information? Or whatever the case may be. But be your own advocate.
Wow. I hear you saying ask questions. Your life depends upon it. Wow.
It does. Yes.
Hmm. I want to pivot a little bit and talk about some of the things that you've done in terms of managing comorbidities. One of the reasons that sometimes people aren't eligible for clinical trials is because they have a lot of other conditions that makes it hard for us to tell how a drug is going to work. Because if you have four other conditions and your kidneys maybe aren't functioning so well, how do we know if it's from your kidney disease or from the drug that we're giving you? So, when we look at who's eligible for clinical trials, historically, some Black women and men have been ineligible based on their comorbidities like diabetes. You've been rocking out and managing your diabetes and you made some changes. And I wonder if you could share a little bit about that journey as well.
You are absolutely correct. When I say the red tape that people have to go through. So, I would hear about a clinical trial and then it'll say, but if you have this or if you have that. Well, here's the thing, one of the biggest things that can happen when you are going through cancer is you can develop diabetes when you're going through cancer treatment. And again, I have to think back to when I would look on my dresser at home and I went from having no medications, I was taking nothing but like a multivitamin, to having about 13 different bottles sitting on my counter. And all of that, it went from, oh, okay, well, you have nothing, but because you're taking chemo, you may need these three to help with your nausea. And they even label them one, two, three. Try this one first. If that one doesn't work, try that one. If that one doesn't work, try that one. And then the nausea meds, oh, well, it may give you some side effects, or this medicine right here may cause you to become dehydrated. So now you need to take this to help with that. Or this one can cause you to have high blood pressure. So I had to say, okay, hold on a minute, stop. And I started talking to my group of doctors and I said, all right, for nausea, what is something that is, just healthy that I could actually take besides taking a medication? And one of them said something about mint. So I was like, huh, okay, well, let me do a little bit more research on that. So I went and tried more herbal type remedies instead of doing all of those type of things. Now, I did make sure that the essentials, the things that they told me that I had to take, I made sure I took those. So with them, with me developing diabetes with that, I made sure that I went to my doctor specifically for that. I followed what she said as far as eating, and when I had an appetite. But I also made sure that I stayed away from some of those things that she said could make that worse. And I was thankfully able to lower my A1C from being about, I think it started around 8.5, something like that. And I'm down to about 4. So I'm staying on that journey for sure.
Listen, you are doing the thing. And what's so important and empowering is when I hear you say that, I also did what I needed to do for my cancer, but I incorporated my nutrition and I figured out how to change some
Right.
things to make my life better. And I feel like in our community, we feel like we have to choose either between, CMOS or chemotherapy. And it doesn't have to be that choice. I'm watching, some of my sisters die right now because they didn't do all of the things that modern medicine, all the opportunities that it can afford out of fear and out of myths. So what do you say to those people who are watching, who are like, yeah, I'm gonna do this holistically? How did you find the balance and what advice do you have for them?
I say just be honest when it comes to your doctors. I mean, they have gone through all these years of educating themselves for a reason. So a lot of them are knowledgeable. But the other thing now, I will definitely say it has been a help for me is that my doctors listened. They didn't just talk to me and tell me. They made me a part of my health care. Okay. So that part was huge because I've heard people say, well, I told my doctor that I didn't want to do this or I wasn't interested in doing that. And they told me that either I do it or I die.
Wow. Wow.
And I'm like, how does that happen? I apologize for that. But I'm like, how does that happen? How can they tell you that? So and don't be afraid to get a second opinion. So if you have to go to a second doctor, do that. But
That's right.
make sure that you're not only listening to them, but they're listening to you. So if you say to them, like I did with mine, there's no way I'm going to take 3 different meds for nausea. Let's figure out something different. Well, I figured something out different and they were okay with it once I just kept them in the loop as to what all was included and things like that. So that for me, I think was huge because everything that they told me and how they said it would work from the beginning, it changed. I was that person that where they say, well, 99% of the people experience this and this goes well, but that 1%, that was me. So
Mm.
I had to make sure I kept in contact with my doctors. I let them know what I was doing or what I wanted to do and made sure that fell in line with what their treatment plan was for me.
Wow. And this is a great transition as we talk about not only self advocacy, but using the power of food as medicine and how it can all work together. And there's a really great resource. And Lucretia, I want you to stay on. We're going to bring you back on along with Dr. Camille, and we're going to talk some more about these things. But there's a great resource I want to highlight right now, and it's called Feed Your Fight. Okay, so there it is. You can see the cover and really what this is. And there was a press release just this week, but Touch for Life launched a book. So two friends unite to serve up immune boosting recipes during Black Family Cancer Awareness Week. Feed Your Fight delivers culturally inspired recipes and nutritional guidance as a strategy to be as healthy as possible in the fight against cancer. It contains recipes and testimonials from thrivers. And this book, again, released during the 4th annual National Black Family Cancer Awareness Week, is designed for Black women facing the challenges of breast cancer. So there's a treasure trove of immune boosting resources. It's got stories that highlight how food has brought families together and how we've been able to change their lives. And the author, one of the authors, Sharon Hawk, said nutrition plays a critical role in the battle against breast cancer. And we want to empower Black women with the knowledge and recipes to fuel their bodies and their spirits. And the inspiration behind that, of course, is none other than Laura Crandon, who's the CEO and founder of Touch for Life, the nonprofit advocacy organization whose mission is to increase the breast health IQ of the BIPOC community. And it is what brings you this programming every 4th Saturday here on blackdoctor.org. So whip out your smartphones, open up your laptops and your tablets, go to Amazon.com. We put the link in the chat because we want you to buy this book for yourself, for your family. Share it as a gift because this is the gift that keeps on giving, the gift of health. Generational health is generational wealth. And so we look forward to hearing your reviews. When we come back next 4th Saturday for SOS, I want somebody chime in. And I tried that recipe for blah, 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 and it was amazing. We want to hear your stories and your feedback about this cookbook because it is going to change a lot of people's lives. So as we continue to move on in our SOS, I think that we have time to now do a little bit of Q&A with the panel. We want to bring everybody up because this is where the knowledge sharing happens, when it's not just advocates or patients talking in a vacuum, but you get the chance to ask some experts as well. So if you're watching and joining us on Black Doctor, start to put your questions in the chat. Y'all heard Lucretia. She said, ask questions. Your life depends on it. Well, here's your moment. Ask us some questions, and I'm going to lead off the questions. And I want to know, what are the most significant barriers that we face in expanding clinical trials and trial participation in our communities? And we can start with you, Dr. Camille, and then we can go to you, Lucretia, for 2 different perspectives on what are today's barriers in participating in clinical trials.
Sure. I think they're similar to what I mentioned before, a mistrust between Black communities and the healthcare system and the research process. But, that mistrust is often, it's valid, like it's rooted in valid reasons, right? And so one of the things that I and others in this field say now these days is that these institutions need to prove themselves to be trustworthy before they feel like we can trust them. And so that disconnect when it comes to trust is still a huge barrier, and one that a lot of people are trying to fill. And I also just think knowledge and awareness of clinical trials and the fact that, you know, they are out there, and they're out there to help us if we want to be involved. A lot more people are familiar with at least the term clinical research now, since COVID, because it was, you know, front and center in terms of the vaccines being studied, and a lot of that information was, you know, on television and in the public eye and in the public space, more so than, you know, research has been in the past. And so I think that's a good thing, because it's made it more I think it seems more reachable to people, but there's still a fear of it. And so there's mistrust and a knowledge gap. And I believe those are the biggest barriers that we're all trying to overcome.
Thanks for that. Lucretia, what do you think?
So I think Dr. Pope is definitely correct. And I'll just say the elephant in the room of, you know, I'm in Alabama, and Tuskegee is in Alabama. And we know what happened with those trials for those gentlemen. And so you have a lot of people that are afraid of things like that. I mean, even with COVID, you know, I had friends and family members that were like, no, I'm not going to do that vaccine because, you know, they're putting something in us that's going to, they're going to trigger us for later and all this and that. And I'm like, well, you know what? My doctor's telling me that I need to do it, so I got to do it. But I think the other thing can be, and I think Dr. Pope also mentioned this earlier, just, you know, transportation, because a lot of it is where you need to come in for this, or you need to have this many visits, and people may live a significant distance away. Again, I was very fortunate in my journey. My hospital, the center that I went to, had, you know, the cancer center that I went to was literally 3 minutes away from my home. I mean, so there was no barrier to me getting there at all. But there were a lot of people that I sat there and did treatment with that had to drive an hour, some even 2 hours away to receive treatment. So for those people, it definitely would not be something that's easy. I think they may need to, I don't know, maybe there should be something where it could be delivered. You know, if it's a clinical trial, it could be delivered through the mail. I don't know. When I was doing my oral chemo, my medicine was delivered through the mail. So maybe that's an option.
And it very much is. I think that, you know, we're learning and we're learning that the words decentralizing clinical trials isn't a bad word. I once talked to a researcher at NIH, and she said, oh, we don't like to hear that because it sounds like we're just going to be distributing them around the country and you don't know the quality of what's being done. And so we like for people to come into our centers. And now that years are past, we're learning that, you know, you can do a clinical trial at a CVS. Right? You might be able to do something at a Walgreens. You might be able to check out and or have a mobile phlebotomist come to your neighborhood and collect that sample and get the things done that you need. And so there is an opportunity, to your point, Lucretia. We're starting to get hip to the game, you know, because we realize that we can't expect people to travel hours and hours, especially when you don't have resources, especially when you don't feel good, especially if there's no childcare, especially if there's no parking, especially if all of those barriers add up. And it adds up to the people who need to be in the trials the most, not being able to be in those trials. So on the subject of promising developments and things, Dr. Camille, Dr. Pope, would you tell us, what are you most excited about? What are you excited about as far as promising developments in clinical cancer trials and the work that you all are doing?
Sure. Well, this isn't necessarily the work that we are doing, but the research sponsors that we are partnering with, what they are focused on. The cancer landscape is changing, where more targeted therapies, we like to say, are becoming available through what is called precision medicine, which means being able to, you know, take a patient's tumor and test it, or maybe sometimes it's a blood test, and look for specific like biomarkers or proteins that are exhibited by that particular cancer, and then develop drugs that specifically target that protein or that biomarker. And that's a game changer, because when we didn't have that, it meant that, maybe you were treated with a chemotherapy, but it was very broad chemotherapy, and it wasn't necessarily specific to, your specific tumor that you might have. And so I think that is something that in the last several years and the years to come is starting to really change cancer care. The key, though, is that when you think about the databases, like the genomic or genetic databases that are used to develop these targeted therapies and these drugs for precision medicine, if everybody is not included, if everybody's genomic and genetic information isn't included in those databases, then you're still developing therapies that might not work in the broader population once they become approved. So even when it comes to, and I know sometimes this is like scary for folks. So, again, making an informed decision. But when it comes to having your genomic information as a Black person, or your tumor tested for certain genetic information as a Black person, having that done and that information included in a database that helps researchers develop better drugs that would target tumors better, like it's important. So as we become more knowledgeable about those things as a community, we're actually helping drugs that are going to help not just us, but everybody be developed that are more targeted and can advance cancer care. So I'm excited about precision medicine.
I love that. Lucretia, same question for you. What excites you either about what you're seeing in cancer care or about the work that you're doing in this space as an advocate?
So, what excites me, I did hear a little bit about what Dr. Pope was talking about how they are taking those, like for me, my actual tumor that they pulled from me, and doing more research on those. The other thing that I'm really excited about is just to see places like Now Included, or formats like Now Included, that are providing more information. So now when I am speaking with someone, or if someone asks me about my journey with breast cancer, they actually know what TNBC is, or the different stages to breast cancer. Because when I first found out I had TNBC, I had, what is that? And they told me like a stage, I had a grade, and all this other stuff. And what is that? But it just seems like it is becoming something that, and I'll just be honest, that Black women are becoming more aware of than we were before. And again, I have to continue to think back to my cousin that passed away, because, I think her passing from breast cancer was very instrumental in me saying to myself, okay, I've got to make sure that I pass down the information that I've learned, because, God kept me here for a reason and for a purpose. So that's where my excitement lies with advocacy.
And it is exciting because you're right. I just put in the chat that, we really do need to learn about cancer biology. And there's simple ways to do it, but all cancers are not the same. All breast cancers are not the same. And what determines the treatment you get, by and large, is what Dr. Pope said. It's the era of precision oncology. We can target drugs now to the precise molecules that your cancer expresses. But we got to know what that cancer is, and we got to have a sample, and we got to have a database, and we got to have a biobank, and we got to have the information in order to be able to give you more tailored treatments. And what that translates into, what excites me, is that it means that eventually there are going to be less toxicities, less treatments that are causing people the harm that impacts their quality of life. On the financial side, it does mean they're expensive, and we got to talk about that. We're going to do a future show on financial toxicity and talk about this era of precision medicine, because somebody put in the chat Keytruda and Verzenio, and those drugs are not cheap because they're so focused and targeted. But in an era where we used to just get the worst of everything, we have the opportunity to now get the best of everything. And a clinical trial represents that. It's the opportunity for you to get tomorrow's treatment today and for you to live and tell the story. So, how can listeners get involved? Like, how do we get people to join this movement? Whether it's advocacy, and please let us know your organizations that you're representing, or if it's getting involved in the health equity movement and supporting clinical trials. And we'll let you talk first, Dr. Pope, and then Lucretia, we'll let you tell us your hashtags, your handles, and the organizations that you're with, and how people can support you.
Sure. Well, we've talked about Now Included a lot. So, joining the Now Included platform, which is the community engagement platform that Acclinate has, and that's the company that I work for. So that's one way. But then there's also so many other just advocacy groups out there. There are large advocacy groups, but there are also smaller advocacy groups. There are advocacy groups that are specific for Black patients. If that is something that is going to make you more comfortable, because again, it's sometimes easier to connect with folks who, you know, look like you, talk like you, been through same cultural experiences. And sometimes we have to do a little bit more digging to find those, but especially in oncology, they exist. Like I know they exist in prostate cancer, like Prostate Health Education Network or Touch for Life for breast cancer. And so connecting in those ways, finding information to educate ourselves, asking our doctors all of the questions like Miss Lucretia mentioned. Feeling empowering ourselves to ask those questions will help us become okay getting involved in clinical trials should they become opportunities for us. And then the last thing I'll say is share your story. And I know some of us, like I personally, I'm pretty introverted, so I don't really share my story a lot. But if that is something that you're open to doing, your story can help change the mind of someone else, and it can help change someone's life. So maybe it doesn't need to be on a big platform, but maybe it's with a family member who's going through something similar to you, or a friend. Just be there, share what you've been through, through your journey, your healthcare journey, and if you've been involved in a clinical trial, share that as well, because it might open the door for someone else to take an opportunity that they didn't even know about before.
Well, that's a mic drop moment, but save some of these pearls for our closeout, because I'm going to ask you 3 key things you want people to take away from this. But Lucretia, tell us a little bit more just about the advocacy and how people can, how can people get involved in this? They're watching thinking, I don't know how to do this. You know, give them some encouragement.
Okay, well, I initially went to some of the bigger platforms, and I do the walk in the
All right, we got the Now Included website. We've lost Lucretia's sound, but I know she was saying that she's done the breast cancer walks. And what we're gonna do now is really quickly, I want to just thank blackdoctor.org, and we're gonna come right back with some closing comments. So stay with us. This is Soul Filling Our Sisters SOS every 4th Saturday on blackdoctor.org. And as we make our way back, I have been so thrilled to be joined with my family, FAMU Rattler sister, my family, Dr. Camille Pope. Hey, she's a chief medical lead for Acclinate, and they have an amazing program called Now Included. We have said it before, we're going to say it again because we want you to be now included. And so go to the website and join the movement to advance health equity in cancer clinical trials. Dr. Camille, you were talking about, just sort of the things that you wanted people to take away, and coming out of Juneteenth and coming out of Black Family Health Week and Black Family Cancer Awareness Week, what is the hope and the future that you see for all of this for us? Give us some hope.
My hope is that there's health equity in every aspect of healthcare. Mm-hmm. There's Miss Lucretia. Hey.
There you go.
Yeah. Hey, I'm sorry. I'm on my phone. And how iPhones do, it got too hot, so it just shut me down. But
Oh,
I just wanted to quickly say that a couple of the places that I have really enjoyed advocating with are a place called Cancer and Careers, where they do a lot of education. Either, you can go to different conferences and summits that they have, or you can participate with various things online. But they also help with like devices to be able to do work from home and things like that. So you're still able to provide have an income coming in when you're going through your treatments. And then locally in Birmingham, I worked with an agency called Forge. And that was the one that I really, really enjoyed because it was actually getting out and meeting people in the community. And they do an annual fundraiser where they have local designers that they'll partner with a cancer survivor like me, and they will design us a dress or a pantsuit or whatever to walk in a fashion show. And that's how they do a fundraiser. So that was amazing. I did that in 22, and then this past year, I started getting phone calls telling me that my picture was on several billboards to promote for them this current year. So that's been pretty cool. And lastly, I will say do not be afraid to join support groups because I joined one. Normally, I'm that person that keeps everything to myself, but it was really, really cool to be able to just express some of my fears, to be able to ask questions about things, treatment that was upcoming, and things of that nature. So, both of those, just being in that support group, really, really helped with those things. And some of those ladies I still talk to now.
I think that that's huge, because you start out doing one thing and you find that, our good deeds multiply and they amplify in this space. So I just want to thank you all, for sharing with us today. I was watching a program where one of the folks who had participated in the Tuskegee experiment was recorded saying that he hoped that his grandchildren and his children would participate in research and have a better experience as a result of what he had gone through, right? It represents an opportunity for repair and for our community to be involved in spaces where we have been disenfranchised. So, as you are watching today, this has been SOS Soul Filling Our Sisters. We hope your cup is full and you have questions, comments, thoughts, and that you are going to take away some key things like now included telling your story and your narrative. Become an advocate. Ask questions. Get involved in the movement for health equity because our very lives do depend upon it. I definitely want to shout out one advocacy organization that is making a difference. It is Touch for Life. Touch for Life is the breast cancer advocacy organization sponsored and created by Laura Crandon, a metastatic thriver who is invested in teaching our community about not only our disease, but our health and our wellness. She sponsored the movement Black Genes Matters, where we are taking the discussion about you and your genes all across the country. So look out for a Black Genes Matter party near you. Laura, we're sending you love and light today, and we're so grateful for the platform that you have provided for all of us today. So we're sending you lots and lots and lots of love. And we hope to see you next fourth Saturday here on blackdoctor.org for SOS Soul Filling Our Sisters. Thanks again to our partners, Hologic, High Impact Partners, our sponsors, our guests, our viewers, and thank you all. We'll see you next time.